Hello, hope everyone's having a good Easter Sunday today. I met with some groups last week and they mentioned that they enjoyed these videos of me talking about some of the MFT topics of the day. So I thought I would create a short video today on economic analysis with MFT. This is an area that definitely needs more researchers and more practitioners adding their knowledge and expertise. Especially right now, there's a number of things going on with healthcare reform, which is impacting insurance companies and Medicare and Medicaid and so forth. And so I thought I'd talk a little bit about some of those things that actually aren't hitting articles and journal publications yet, just because it's rather new. Um, but just to let you know, some of the things that's going on is with the new healthcare reform, there are going to be a couple of changes out there that will impact us as practitioners. I won't go into too many details, but some of the areas I think are interesting is uh, uh, the impact it has on businesses, small businesses, corporations, and so forth. One of the things that's going to happen is any company that has 50 employees or more are going to require to have a wellness program. Now, a wellness program can mean lots of different things, but what we're discovering right now is a lot of companies are seeking out wellness programs that include mental health, relational health, more of a holistic approach to wellness, and that includes things like counseling, health coaching, which a lot of family therapists that are trained in medical family therapy are starting to get into. And so right now it really isn't hitting us yet, but as of 2014, companies will be required to have this wellness program, and a lot of them are going to be looking at uh, family therapists as a possible practitioner that could be incorporated in these wellness programs. So that's just one thing to keep in mind. Some other things that are going on is because Medicare and insurance companies are cutting down some of the costs or some of the reimbursement amounts. Hospitals, especially, are feeling burdened by the amount of money they're getting. So basically, you have these hospital systems that have a lot of assets. You know, they have buildings and machines, and they have to pay for these things. And so, in order to do that, they spread out the costs among different types of procedures. You know, that's why if you go to an emergency room or something like that, it can be pretty expensive just walking in the door because a lot of these costs are actually covering all the hospital costs. Um, and so you hear of people paying $5 for a Tylenol pill or $5 for a cup, and that seems pretty extreme, but in general, the reason that's happening is hospitals are feeling the pressure of getting less money for Medicare and insurance and things like that. But that being said, what's happening right now is a lot of people, especially corporations and other entities, are trying to focus on preventative health care, and that's another piece that adds to the importance of mental health, relational health, and things like that. In the medical family therapy world right now, there are a lot of studies coming out showing the impact that counseling and family therapy and addressing stress management, life balance, and things like that have on your health. There's some studies that have shown 40% reduction in utilization of insurance. So what that means is if someone is going through a wellness program or through counseling or through coaching or something like that, they will use less services over time because they're healthier. Things are going better. I mean, we know that for a fact that uh, couples that are doing better as within their relationship have better health. People that have less depression have better health. People that addressing anxiety, that definitely impacts the health of the heart and other things. So we know that that if we can engage in a counseling or coaching process ahead of time, uh, studies show that we do use less insurance. So that's a good thing. There's more and more studies coming out like that. That all these things have to do with economic evaluation. The whole idea behind economic evaluation is companies, insurance companies, citizens, patients, clients are asking the question, where do I get the most bang for my buck? And so, to give you an example, when I was working in Mississippi right after my master's degree, I was working in community mental health in rural Mississippi, and these counties would have these community mental health centers, and really it was the only center that you could go to if you had Medicaid. Now, the problem with that is it creates sort of a monopoly type system where people don't have a choice. If I can only go to one place, that location doesn't have much of an incentive to do a good job. Whereas if you have two places, for example, in the county, and now all of a sudden you have a choice, well, each location is going to try to do the better job, and so they're going to hire better people, pay them better, and so forth. It just helps everyone involved. But because a lot of the system is monopolized like that, what ends up happening is you have a poor service, especially for those that are poverty stricken or have to utilize things like Medicaid or CHIP. Now, with economic evaluation, uh, the question comes to mind, well, is it even worth having Medicaid pay for those types of things if it's not going to do much, if the quality is not very good? The other question comes to mind is in these systems where adolescents go to juvenile detention hall or go to these wilderness boot camps and things like that, and they pay lots of money. Is it worth it? Does it save the government money? Well, what we're finding is certain types of programs obviously save the government, citizens, patients a lot of money. For example, if you send a kid out to a boot camp, uh, the recidivism rate's really high. They end up returning home, and the system that they live in hasn't changed. They may have changed a little bit, but the system oftentimes is stronger in the individual, and so they end up resorting back to old behaviors. However, if you can use a program that is systemic, that focuses on the family and the community and engages in these types of systemic interventions, it does show long-term change. And in actuality, as you'll read in some of the studies this week, it has significant savings. For example, if a kid, a teenager goes into one of these programs like a boot camp and you spend $50,000 on that kid, and they come back and they still commit crimes and they have to go back in the system, you just paid an extra $50,000. Whereas if you go to a program that works and they don't recommit a crime and they end up doing better and becoming a great citizen, well, oftentimes you've actually saved them quite a bit of money because the amount of money you would have had to spend in the system over the years is a lot more than the amount you spent on the program. So that's kind of what they're trying to show is that if I spend $50,000 in this systemic program that addresses the family, the community, everything, in the long run, that might save $100,000 or $200,000 on the system because they don't have to keep going through the system. Um, Same thing with insurance. If I have a family that's on an insurance panel and they get counseling, uh, a lot of the studies are showing that they're much more likely to have less healthcare costs over time because they're taking care of their family. They're considering their relationship, their kids, all these things that impact stress, anxiety, which in turn impact health. And so right now, marriage and family therapy, systemic interventions that can be within a wellness program or a coaching setting or medical family therapy or any of these types of issues that are addressing economic evaluation, we're in a good spot. Every research study that's done shows that we cost just as much, if not less, than other alternatives. Meaning, worst case scenario, we're going to cost the same, and that's the worst case scenario. And in most cases, we save people a lot of money. Um, with these wellness programs that are required, with the healthcare reform and insurance panels reimbursing more on how healthy people are. That this is really going to be a big deal for MFT, meaning that the more that we can show that when we work with a couple or a family, we not only impact their relationship, but we impact their health, which in turn impacts the amount of uh, it decreases the amount of complications or procedures they have to get down the road. I mean, people are healthier as they address these types of things. So, uh, I don't know. Just want to get you thinking about this. Most of you will never think about this again, probably. Maybe you will, I don't know. But if you want to get into an area that really is going to go through some pretty mighty changes and in a positive way, economic evaluation is definitely one of those areas. And if you can align your practice or you can join groups that tap into uh, this movement into wellness and preventive medicine and showing how these types of treatments can help improve people's lives, not just in terms of their relationships, but in terms of their health. Those types of entities are ahead of the game. They will do well, and they'll continue to do well. So hopefully that helps you gets you some ideas about some of the things going on with economic evaluation, especially with what's going on right now with healthcare reform. So, okay, have a good week.